I think a lot of people still think that the GP is the go-to person when they've got a problem with their eyes. I think that there is still this lack of knowledge about the quality of our optometrists these days and the very specialist equipment that they use. So they go to the GP. Now, what they need to know is that GPs will do their best, but the amount of training they have in ophthalmology as junior doctors is very, very small. The only equipment we have in our surgery is an ophthalmoscope. And in the rushed 7.5 minutes that most GPs get with their patient, we really can't do much more than a cursory examination of the eye. It's much better, I know, for people to go to their optician for a thorough examination with all the equipment that they have on hand to get the diagnosis. And of course, these days, optometrists can refer direct to the ophthalmologist in the hospital. They don't have to go back to the GP, which is such a cumbersome arrangement for the patient. I think we need to be a lot more honest about the limitations that we have in general practice. We might be very good at detecting red flag symptoms of something serious like a brain tumour or MS or migraine, but I don't think we're nearly as good at looking at the eyes from outside to in to look at the subtleties of diagnosis, what's needed for good visual acuity. I think really we should be referring most of our patients with eye symptoms to people with the proper equipment.